Odin presents Real Talk for Nurse Educators, Episode 3, Drawing the Line. Real Talk is designed to create space for honest conversations about the challenges facing nursing education. The views shared in this episode are those of the speakers and participants and do not necessarily represent the official position of Odin.
Hi, friends. I'm Dr. Nicole Heimgartner, and I'm here with some friends today so we can have more real talk. We're going to talk more about resilience and how that relates to some big topics in our profession.
Hi, and I'm Dr. Cherie Rebar. I am here for Real Talk 2 with Nicole. You know, we like to have this little session every now and then and pick up where we left off. But we also have another special person with us today that we would like to introduce before we get started, and that is Dr. Daniel Flores. He is part of the Odin board, and he is the director of the Southwest region. He also is an associate professor at San Antonio College, and that gives him a wonderful bridge in between. He sees some things from that clinical environment as well as the academic one. And so we've got another voice with us today to talk about. So I think today what we're going to start with, Nicole, is we're going to be talking about how incivility affects us as nurse educators, whether we are the nurse leader, whether we're the nurse educator, whether we're the nurse clinician at the bedside, whether we're the new nurse that's out there. Because that's one thing that we hear that word tossed around a lot. It's almost like resilience. That word is tossed around all the time, and incivility is tossed around. We kind of just blow it by because we've heard it so much, but it is critical that we actually talk about incivility and why it matters. And I think one of the things I'm going to start with and then just send it back to you all is that what we allow in nursing academia is what continues in clinical practice. We have said for a long time that there are bullies in nursing. We've said for a long time we want that to stop. But where does that originate? People don't just go from nursing school where everything is supposedly great into a clinical environment and become a bully. It starts someplace.
Mm-hmm.
So let's talk a little bit about that, where that comes from, because, you know, faculty culture in and amongst themselves and with students, that is very telling about how a nurse's professional identity is going to form.
Yeah, as we've talked about resilience, and we've said this for our last couple sessions, how many hats we wear as nurse educators and how many roles that we have to really master as a nurse educator. We had the discussion about AI, another thing that we've got to kind of police and figure out, and the genie's out of the bottle. And we had big discussions about that and great opportunities for how to incorporate that. And now, as we begin to look at different things that also impact our resilience and our ability to wear all those hats, we kept coming back to the idea of incivility. And Cherie, I mentioned earlier to you, I follow lots of online threads, nursing profession, and
You do.
I have seen so many posts in the last few months that start with, is this normal? And it'll be an educator that is describing a scenario that's really just rooted in incivility and asking, is this the way it is, or is this the way that it's supposed to be? And I think we have to address that, because we have the power to change what civility looks like in the profession moving forward, and especially with the students that are in front of us. But it takes wearing another hat, because what you said, what we allow is what continues.
Yeah.
And it takes time, and it can be intimidating, especially with students, to address, especially incivility in the classroom. It just takes time. And it's some things it's easier to let go. But when you let go of them, what happens? They build and they continue. And if there's incivility in academia in the classroom, where does it end up?
The clinical.
It ends up in the clinical. And then, and talking with Dr. Flores, he's got students that are experiencing it from nurses. Did you want to share that with us?
From my perspective in the clinical environment, the behavior has become an acceptable component of a practice. The scarcity that we have has become an accepted behavior. We have let go the psychology, and we were talking about fear earlier, the scarcity psychology and the organizational avoidance that they are not acting on the behavior, creates an identity drift, and we no longer, or an identity that has become accepted. And if we don't act on it, then it becomes an experience that is just part of the day. And this is where I believe administration or higher up need to start addressing the behavior and then acting on it, and then risking short staff being, we already have a scarcity of staffing, but risking one less employee, but taking care of the problem so that we can change the culture. It's become, if you think about it, most units that have a problem is we can do it. It becomes survivor identity. It becomes part of the custom. We've done it. You can do it. This is the way it's always been done, and we have to do it because I may be very skilled and fast and smart in what I know to do to identify cues of a patient going on, but my attitude really suffers or causes havoc. It's just part of it. We're going to do it. We're going to do it. So it becomes perceived behavior, and then we become immune to it. We become immune to it, and then
Yes.
Absolutely. We let even in the classroom, things that we just let go of because it's harder to address. But I think really connecting with students in terms of, most of the time I find, and you all correct me, tell me what you find, but when I have students that are reacting or acting in the classroom in a way that is just not professional, it almost always goes back to fear. I fear of I'm going to fail the test, fear of I'm going to say something that's dumb, fear of the things that pop up in academia. Same thing with my patients. My patients are acting out about things like I don't like my food or my sandwich and having really a fit over that. But the issue is the fear over what the doctor said or what the healthcare provider told me a little bit ago. So I think when we look at the underlying issue behind some of the behaviors, that can help us in academia, not only to address it with student behaviors, but to help them to understand their patient behaviors as well. Do you guys find that as well?
I do for sure. I think that the fear is the underlying thing of everything. And I could even tie that into leadership because often leaders have a fear of confronting these things, whether they're in the clinical environment or the educational environment. One reason Dr. Flores said is because they don't want to lose somebody because, oh my goodness, we may be shorter staffed or something like that. Or, nurse educators, oh, we don't have enough clinical faculty as it is, or that's just how somebody always has been. So it's easier to just let it ride. But unfortunately, it affects the whole team. I would much rather, and I think psychology would prove this, much rather confront the behavior of the one or two that are causing the havoc, lose them, and I know that sounds sad, but then allow that team to flourish because they will reestablish themselves when they don't have to dance around the other person or the few people that are causing this kind of discord. And I'm not talking about conflict in terms of incivility. Like we're always going to have conflict. Conflict can be good. Conflict doesn't inherently have to be bad. I'm talking about that person or a couple of people who always subtly undermine someone else, who will say something to other people kind of in like a kind of a catty way. And I'll give you an example. Like when I was first a nurse, I asked a lot of questions, as I think is good for new nurses to do. Better to ask than to do something and make a mistake. And I had a nurse person that she was a senior nurse, not a nurse manager, but she would say things to me like, Cherie, as I've stated before, And then she would go into whatever it is she's going to say. So again, that's that undermining, that public criticism, the things that make you feel like you're less than. We're not talking about just, having a difference of opinion. We're talking about people that actually kind of in a weird way go out of their way to make others feel like they're not welcome. And yet they end up with the power even if they are not the leader. So that's what we want to talk about today is how do we confront this? This is not something that one person can make completely change or make completely go away. This is a collective effort. But earlier before we started recording, we were all talking about the fact that this generation of student nurses, the ones that are coming in now, whatever age they are, we're just talking about them being in school at this time. These are the people, as well as those of us that are out there teaching and practicing clinically right now. We have the power collectively to make a change in the way that incivility keeps showing up in the profession, but it takes every one of us. It's not a one and done thing. It's not one person that makes that change. It is collectively saying we have to do what we have to do in our individual practices to not allow this to continue. Because again, what we allow is what continues. So, what can I do as an individual in my role, whether I'm a nurse leader, whether I'm a clinical nurse at the bedside, whether I'm a nurse educator and I'm working with students? Those are some of the things we want to unpack today, because one of the things we are very passionate about is giving tangible solutions, tangible takeaways, not just to talk about the problem, but actions that you can take to confront incivility, because that's really a big topic. How do you just up a sudden one day decide I am going to confront incivility? We need some tools to take with us, because otherwise what happens is we are going to continue this moral distress. We are going to continue this emotional exhaustion. And one thing that I see is you've got people in the clinical environment that are nurses that say, I'm tired of all this stuff. I'm tired of these patient things. I'm tired of all these requirements. I'm going to go to nursing education. And what do? They just bring it right over there. Or the nurse educators are like, oh, I'm tired of these students and I'm tired of all this kind of stuff. I'm going back to the clinical environment, and they take it over there. So it's just this self-perpetuating cycle. So whatever side you are on, I think we need to collectively remember, first of all, we're all on the same side, which is bettering our profession. And then the second thing we have to think of is that we do have the power, each of us acting in our own domain, to be able to bring forward changes. It's not overnight. This is going to take time, but we have to make a commitment to ourselves and to the profession at large to stop this, because bullying and incivility in nursing has been around since I became a nurse, and that's a long time ago. So it has to stop, and now is the time.
I'll echo that. It was a long time ago.
Not just for me, for
Sorry.
you too, girly.
Yeah,
We've all been out here a long time, and that is real talk.
that's real talk.
But
If
again,
you
why should we still be seeing that in the students that we're producing today? We shouldn't.
Right.
if we think about leadership and the leadership role, they're in a really tough spot because if we act on it, we risk losing a staff member. But if we don't act on it, then we risk losing the culture or the standards of the unit,
Yep.
and that's the predicament that they're in. My example of I have a nurse that is excellent on the floor, very very sharp, very critical thinker, and can identify and is just putting out good work, but has a really bad attitude or is incivil. Instead of saying, you're fired, why doesn't leadership go to that person and say, you are extremely valuable employee? Because you're a valuable employee, we need to change the standard of what we're delivering here and address it that way. I don't know if that would work or not, but if we try to make them see the good of them and not just highlight the behavior, maybe that would work. But our culture is already suffering, and again, enabling or perpetuating that the time has come that we need to take action.
Yeah.
I agree
And it
completely.
just it chips away at our resilience, both as bedside provider, nurses, and also as in nursing academia as educators. It just chips away at that ability to bound, every time you deal with those issues. And, one thing I do want to kind of circle back to just a little bit is to reiterate that conflict is not incivility. I think sometimes there is a misunderstanding.
Yep.
I disagree with you, so you're being mean to me.
Yep.
And I just want to reiterate that respectful disagreement is powerful for the profession. It can help us to grow, and it prevents groupthink. We don't want a groupthink environment where everybody just agrees with everything for the sake of agreement, because we'll never have
a practice.
growth. So I think that's just a really important thing, that just because sometimes something feels uncomfortable doesn't mean that it's incivility. Incivility is specific behavior, like a chronic gaslighting or manipulating policy, or a lack of clarity, lack of guidelines, or being excluded from meetings or curricular decisions that directly impact your role. The ANA's defined behaviors that this is incivility. This reflects incivility. So, we can recognize that through the definition, and we can use that to teach our students. Hey, did you know that what you're doing right now is really defined as incivility? Did you know
Yes.
that?
I
And
think that's so important
yeah,
to
because a
pull
lot of
out the
times
professional standards.
they don't recognize
Right.
that the way I'm being perceived is this. So, but I think that, I just wanted to circle back to that, and even being confident in your expertise, that's not incivility. Being rude is.
Right.
But being confident and saying, no, I know this to be true because evidence shows me XYZ. I see this in my practice here. I know that in being passionate isn't incivility. Being rude is. And so I think that's where, having that clear delineation. And, when we were talking earlier, one of the things that we kept going back to is helping students, helping faculty separate the feeling from the issue. Most of the times it's rooted in fear, and the issue doesn't have anything to do with the feeling. Like, I understand that you're frustrated with me right now, but let's try to look at what is the issue.
That's good old therapeutic communication, isn't it?
Absolutely. But we lose that a lot of times when it has to do with ourselves.
Sometimes we don't want to let go of the feeling. We want to keep it. We hold on to that.
That's true.
That is
That's
very
true.
true. And
Let me comment just briefly on, as a School of Nursing, we are vying for any clinical unit we can get.
mm,
I tell my students, you need to address incivility in a very professional manner. But a lot of times, one example of Monday's clinical, a student went up to the primary nurse and said, You need to care about this patient. This patient is crying." The student had to tell the nurse that. Here's the thing, I think, and even for leadership at the college level, they're telling us to be very careful and not upset the visiting site, because then they're going to mark us as troublemakers and you're not going to come back.
Yeah.
And so, again, we're accepting the behavior just so we can get into the hospital. You know, it's like our hands are tied. So are we going to bite the bullet and say something and risk losing a clinical site? It's a vicious circle that we're trying to manage.
right. And you know what? I really think a lot of times in academia, well, in every academic institution should have a professional advisory board or professional advisory committee. It's required from accreditation standards. Cherie and I were just serving on one, but I think that bringing up this topic and that very thing in that type of environment so that the professionals that are on the advisory boards for colleges can understand the impact that it has not only for their organization, but to the profession as a whole, I think that is a fundamental way. And a lot of times, I think professional advisory boards or committees are really underutilized because they're just a box to check. We did this because it's an accreditation piece, but there's power in that board
Yes.
in terms of making changes, just like the one that you said, being gut level honest with this is what my students are seeing. And we're afraid to say anything. We want to be good partners. So that's an avenue that I really think that we could capitalize on, um, versus it being this is our once a quarter meeting and is everybody happy? And because that's usually what it is. It's a very structured, ABCD, check the boxes, instead of what are the real issues that can impact us.
I think that's where relationships come in
Mm.
within that advisory board. One of the most successful groups that I've seen that has done this had an advisory board with every single clinical agency represented on their advisory board, by whether it's their clinical coordinator or nurse managers or something like that. And I know that's not an uncommon practice, but this particular institution was very deliberate about including every one of those every single time that they had something to communicate or have a meeting with. And to Dr. Flores's point, if there was a problem with a specific nurse or a specific unit, it became very easy for leadership to talk candidly with whoever the clinical representative was, not in a finger pointing kind of way, but in a collegial way. We know we want to give our students the best. We know you want the best of our students for the best of your practice and for your unit or your agency, et cetera. We're finding there's a concern with ABC. And those folks could help work together to solve that. That's not going to happen in every single advisory board, but it does speak to the power, I think, of relationships, because then it takes it away from just that systemic kind of thing of, like you mentioned earlier, oh, we're going to lose an agency, because I see that all the time. In one of my areas that I'm in regionally right now, they serve 64 undergraduate programs. I mean, that's just crazy. And I don't even live in a big city. I live in a city, but not a big city. So if that's the case in regular old Midwest generica, what is it in the large cities? Having those relationships that are forged and deliberate can make a difference. But again, that's not an overnight thing. It is something that has to be focused on. And Nicole, to your point, it has to be continuous. It has to be deliberate over time. I think one thing we want to make sure that we hit on, because knowing that we don't have all day to talk about this, although we could, because this is one of those real talk topics that just could go on forever. One of the things that we want to talk about is how the individual can help themselves to be able to confront bullying or incivility in a way that is A, tangible, B, professional, and C, I don't want to say self-serving in a bad way, but self-serving meaning that it serves a point. It's not hitting back just to hit back. It is actually being able to address behaviors in the moment with a reason that is serving the purpose.
Mm-hmm.
So if we could shift into that just for a minute, I think one of the first things that I would like to toss out there for us to consider collectively is this cognitive reframing, because I don't know a nurse alive, I don't know a nurse educator alive that doesn't have some tie-in of their role to who they are. And I'm guilty too. You can't always separate yourself from being a nurse. A nurse is part of my identity. That's who I am. But I think it also becomes very, very common for us to start tying our worth into that. And our worth is just a piece of many different things, not just our role as a nurse.
Mm-hmm.
So, how do we confront that, especially for new educators or new nurse clinicians at the bedside who already have some degree of imposter syndrome?
Mm-hmm.
How do we help them know that their value and their worth is not completely tied to what somebody else thinks or just to that role?
Right. Well, to me, I think it goes back, and we talked about this in our last Real Talk, how we can be an expert clinician, because let's face it, most people come into nursing education as an expert clinician and a novice
Educator.
educator. Okay. So we're operating on two continuums because we're still an expert as a clinician, but we're still very much a novice on how to be an educator. So we have to accept that because that promotes our resilience to understand, okay, I can claim my expertise as a clinician
Yep.
and also my ability to grow as a novice educator and grow into an expert as an educator as well. And so I
That two
think that
things can be true at one time.
exactly. And I think that that can be really helpful when we're looking at our personal worth, especially when you have maybe faculty that have been there a very long time and you're trying to bring forward ideas that and you get the well we tried that 20 years ago and it doesn't work.
Yeah.
Right? I mean, have you heard that? Yeah, we heard that.
All the time.
So,
Yep.
or you're just talking about new things like AI is out. Well, we're not even going to deal with AI. Well, you got to deal with AI whether you want
Yeah.
to or not. So those are the things that looking at that again, living on both ends of that continuum there and continuing to grow as an educator, I think is really important. And then also just looking at our own emotional regulation skills and how we respond when there's conflict. Like I said earlier, discomfort doesn't mean incivility. But sometimes, I believe, Dr. Flores, you mentioned we like to hang on to the feelings because the feelings are what drive kind of that response. Just a technique that I use personally is if I'm upset about something, I write my email like, set your hair on fire, say whatever I need to say, move it into my draft folder, and let it sit for a day.
And
And then
hope you don't accidentally send it.
well, I don't put a two. Don't do that. So
Exactly.
never
Let's put
put
that
oh, it's
caveat.
two in there, so you can't accidentally fire away.
That's right. That's right.
So
Just
no,
write the email
exactly. Just write the email, or put Sherry's name in there.
because you can send it to me and that's okay.
It's okay. So move it into my draft, and then the next day I'll bring it back, and I'm like, okay, what is really the issue here? Take all of the feelings, all the subjective out of it, and make it what is the objective issue.
Yeah.
And it's always okay to share that made me feel XYZ. I
Right.
think that's okay to share because I think that's part of our humanness in relating to
Yeah.
each other. But I think that can be a tangible skill for how to maybe control a little bit of that emotional response. And, for our students, we need to teach them the same thing. How many emails have you gotten from students because they're mad about something in the moment?
Yeah. And
And
they
then
should have just stepped away for a second.
exactly,
Yeah.
and your response is often, is this something, would you have said this if I was standing in front of you? The
Right.
answer is
Yeah.
almost always no.
Well, we live in a world of keyboard warriors. And I don't
Exactly.
just mean students, I mean just anybody in general. All you got to do is go look at the news where people post discussions there, online, or you look at any social media. People will say things they never historically would have said in person. But I want to go back to something you said there real quick, Nicole, about it's okay to share those feelings. I think it's also okay. You mentioned, put my name on the email because you and I do a lot of proofing for each other of all kinds of things. But if you have a trusted colleague that can look over something with you after that moment has passed, and you can say, okay, I need to answer this, or I need to respond to this, or I need to say something about this. Is this objective? Did I approach this professionally? Because I think that helps too, because we can't separate our feelings all the time. They are still in there, but we can have somebody else help us with that. I know many times I've sent something to you, or you've sent something to me that says, does this sound okay? Is this professional? Because I know that the day after we experience the emotions, we really don't want to just fire that off. It's just how we feel. And
Right.
that was a big lesson I had to learn when I was a new nurse educator and a new nurse leader is it's okay to sit on an email. You don't have to answer it 3 seconds after it comes in. Heavens, you don't have to answer it that day. You might need to take a day to go away and have a meal and get a little sleep and then be able to think about that in a way that you can phrase what you really need to say and want to say without it polarizing the situation even more. But I
Right.
do think there's some times that things happen in the moment that we do need to have some language for that too. And
Right.
this goes back to, I'm going to just use the quotations, that person, because everybody has that person in their organization or in their unit or in their faculty that will say things in the moment that are meant, sadly, to undermine someone else. So how do we confront that in the moment? Because you can look around the virtual table and see everybody's uncomfortable.
Mhm.
But how do you confront that? And the other question rhetorically is, does it have to be the person that it was targeted to that confronts it? I'm going to say no, because if I see someone bullying someone that's sitting at the table, I think it's okay for me to professionally say something, especially if that other person maybe is not as comfortable or maybe isn't as experienced within the team. Because again, what we allow is what continues. And I think it's okay to use some of that professional boundary setting language so that
We
we
should
learn to
do that.
work.
I'm sorry. We
That's
should feel
okay.
to make that, to correct that behavior when we see it.
Yeah.
I think if I can add a component to where we are with incivility, I truly feel that schools of nursing have really forgotten about professional identity formation in the classroom and got more focused on results and flex preparation and student learning outcomes. And we've lost that. And I think we need to bring that back into each semester and teach our students what it truly is to be a nurse. What do you mean? What is it to be a nurse? What's the behavior expected? Why do I feel like I am where I'm at? I think we've lost that component in our classroom because of the challenges from administration saying, let's get them out, let's get them out. There's a big nursing shortage, and we've lost that sense of professional identity formation. And I think
Yeah.
Yeah,
they,
and I
students,
agree.
they're
I
coming out skilled, they pass their NCLEX, but they don't know what it is to be the nurse that I truly am supposed to be.
That's
right.
right. Right now, we've got 9% of graduates that are ready to practice at a level that is equatable to entry to practice. And that is just the clinical decision making. I would love or maybe fear seeing a study on how many come out prepared to have a formative professional identity and ready to grow that.
So here's just a tangible thought too, is have we lost in terms of course outcomes and program outcomes, including those I don't like the term soft skills because I think they're very important skills,
Oh,
but that idea of professional identity within course outcomes, course clinical skill evaluation, have we lost that? Is that a way that we can also, just like connecting with our professional advisory committee in terms of creating some of those tangible steps? And this might be a really good place for us to kind of wrap today up. And then when we have our watch party, I would love to hear their thoughts on how can we bring that idea of professional identity, which directly connects to addressing the ideas of incivility, back to the forefront and promote resilience for us as the faculty and resilience for our students as well. I mean, I think that might be a really good place for us to wrap up and look at ways that other ideas that people may be able to bring to the table. What are your thoughts on that?
I agree with that. I think that we can bring some more of those tangible, actual phrases forward. I think we can bring some actions forward. And I really think that to Dr. Flores's point, we have to talk about measurability and implementation of formation of professional identity because that is not inseparable from resilience. In fact, it is the foundation upon which resilience is built.
Exactly.
exactly. It should be the foundation. Knowing who we are in the professional world. If we don't have that foundation, then we're going to be really on really
That's right.
unstable ground, and that's where we are. That's where we are.
Exactly. Exactly.
Well, this is about as real as it gets, folks. So with
It
our
always is.
talk, and Dr. Flores, thank you so much for being with us. Cherie and I can chit chat and talk all day, but it's always great to have somebody to be with us. And your examples that you shared were excellent and just really helped us connect and develop just real talk with nursing educators.
Yeah.
To get more insight and thoughts from all of our friends and colleagues. And we'll look forward to that.